Hello, everyone. I'm Jason Mantzoukas, and I'm excited to be here today to interview Dr. Kiame Mahaniah, a practicing physician and the Chief Executive Officer at the Lynn Community Health Center in Lynn, Massachusetts. 2021 marks the health center's 50th anniversary, and this is the first in a series of videos to celebrate the significant impact of this organization. I might seem like an unlikely choice as an interviewer, but rest assured, there is a connection here. My father, Bill Mantzoukas, was one of the founders of the Lynn Community Health Center in 1971 and served as its first executive director. I think I've been to almost every physical iteration of the Lynn Community Health Center, so I am very delighted to be here virtually to have this conversation.
Jason, I'm very excited that you're here. I'm even doubly excited because of the relationship with your father, who's been a mentor of mine for many years. And I'm very excited about this conversation as well.
It's been a wild, unprecedented year this year, the year of COVID, as well as many other things that we're going to discuss in this next talk. The pandemic has laid bare many of the deep injustices in our society and specifically in our healthcare systems. I know that March 4th of last year, 2020, the Lynn Community Health Center launched its emergency operations plan in response to the COVID-19 pandemic. As you kind of saw this whole thing unfolding, how were you planning for it and how has it kind of come to pass this last year?
Yeah, so in many ways, we were lucky. We decided whatever we were going to do, we had to protect the hospital. That was like our first mission. In the beginning, we didn't have enough PPE, we didn't have enough tests. So it was really a leap of faith for us as a community to say, okay, we're going to protect our community by seeing patients, by remaining open for urgent services so that those people don't go into the hospital. What really was amazing was the response of the health center staff. Everybody was really supportive of this idea that we wanted to serve our community, wanted to make sure that we did everything we could to stop our hospital from being overwhelmed. So we remained open, and the real difference that really happened to us was when testing was finally available. Within 3 weeks, we were able to start testing thousands of people a week. We were able to also offer social services. So we were able to wrap this around and really provide services to our patients.
That's great. Kiame, you mentioned that the workflow at the health center changed over the course of the last year, having people working from home. I'm curious, like for an organization like the Lynn Community Health Center, how did you all have to shift how you worked and how you treated and saw patients throughout the course of the COVID-19 pandemic?
The shifts were brutal. We probably had around 200 employees who didn't have the equipment necessary to work from home. So our first week, I think we just bought equipment, trained people, sent them home with the equipment. And then we had to identify, okay, which of our services are we allowed to do remotely and which of our services can we not do remotely and we have to either do in person or stop doing. We also knew that there was some work we just wouldn't be able to do, meaning how do we repurpose those employees? One of the things we really wanted to avoid is as this economic crisis unfolded, we didn't want to add another financial dimension to people's anxiety. So as we were repurposing people and redesigning their work, we essentially had people doing things that they never would have imagined doing even just 10 days before, just because it allowed us to keep everybody employed and allowed us to keep providing the services. But I must say, now it sounds like we had a great plan and we all went step by step, but really it was flying the plane as you were building it. Literally on Monday, we wouldn't know what we were doing on Friday. I was really worried about our staff's ability to withstand that amount of stress. I mean, there were days, Jason, where we changed a particular workflow 4 times in one day. And I was just so impressed by our staff's ability to respond. And I think it's really because they saw themselves as an essential part of the response. They knew that there wasn't really an option. We knew that if we faltered, the whole community would suffer.
I wonder if you can speak a little bit to, as your kind of organization's main thrust now shifted to giving the vaccine out? Like, is that now where you guys are kind of focusing your energies?
One of the things that I was always worried about during the pandemic is, well, yes, we're doing all this testing. We're taking care of all these people that may have COVID symptoms. What's happening to our patients with diabetes? What's happening to people who are having strokes out there? We have this incredibly close connection with the city of Lynn. And they provide actually at least half of the staff in the immunization clinic. They're providing, they're paying, they're training, and we're doing the other half. But then 80% of the rest of our staff is really concentrating on, can we address this backlog of healthcare issue that has built up before these really become serious medical issues, before the heart attacks happen, before the strokes happen, before the diabetic comas happen. So it really is, you're right, that it's a challenge to have the energy and the bandwidth to put up a whole new service, which is the vaccine clinic, and yet at the same time retain enough energy and wherewithal and managerial bandwidth and staff to provide the regular care that is desperately needed.
I wonder if you wouldn't mind talking a little bit about how the ability to have telehealth or telemedicine increases people's access to care, but also comes with it a bit of a difficulty because not everybody in the communities that you serve has the ability to log on and get online and interface, using a computer or whatever.
One of the things in healthcare that you probably have experienced yourself is that sometimes we make things really, really inconvenient for customers. And one of the visions that we have for our telewellness program is essentially that the patient will have the ability to choose. The idea is that we're trying to provide a flexible arena that includes phone conversations, obviously, but it also includes video. It also includes asynchronous contact, meaning that you want to be able to leave messages for your nurse, your provider, your community health worker, and just get an answer later on. As one of the outgrowths of this, we've really identified the digital divide as something that's really affecting our patients. And we're part of several programs, some grants, some government funded, to get equipment to our patients, to get them the technology, to get them the bandwidth and the training, but also for the last portion, to figure out how will we provide spaces where people can actually have privacy. Should we be having moving vehicles? Should we establish sort of like, LCHC phone booths where you go in to talk to people? So we're really thinking about that because we don't want this next generation of healthcare to increase the inequities that exist. So we really want to make sure that as we're moving to this next generation of healthcare, we are actually making things better and not worse.
Are you taking tools or workflows from this year and saying, oh, this is actually a good way to think about things moving forward? An interesting way, whether it's technologically or whatever, I guess, has it given you new insights into treating people?
I think, yes, there are definitely some new better that have emerged. We are definitely thinking about some dramatic changes. And interestingly enough, about 60% of our patients really would prefer not to do telemedicine ever again. But a good 40% of our patients say either I want to stick to telemedicine or televideo or telephones, or I want to have the option of choosing to go to it occasionally. So yes, we are thinking about it.
I know that the COVID-19 pandemic has been just economically devastating, especially in communities like Lynn. And I wonder how the Lynn Community Health Center has reacted to what is, I'm sure, an economic crisis inside of a health crisis. How have you guys responded to that?
Lynn is one of the cities with the highest proportion of what's considered essential workers. It's one of the major reasons why in the beginning, when we didn't know where our money was going to come from, we decided as a leadership team, we were just going to gamble our reserves. We decided we were just going to keep everybody employed as much as possible. Because I just couldn't see us worsening the crisis in the city by laying off 200 people, 300 people. That was really a big way in which we contributed.
I'm sure that's got to be an enormous part of the organization, is predicting where the next kind of difficult thing is going to be and how can you be of service inside of that.
Yes, if you look, 50 years ago, and actually your father was at the forefront of this as one of the founders of the health center. At that point, they predicted that mental health was going to be a huge deal. And he and his partner, Dr. Hayes, were actually 30 years ahead of the curve, right? In terms of recognizing how important behavioral health was. I think for us, it's natural to now be thinking, okay, the next crisis is around housing. So what do we need to build? Because whatever medical problems a person has, they do not get better when the person becomes homeless. We are connected enough with our community that we actually hear what's actually impacting them and what's bothering them and where they need us to use our voice to advocate. So I'm always worried. Are we really hearing what's happening? How do we know what's happening? How do we know what to advocate for? But at this point, we know that housing is really the next big crisis, and that's where we're focused our advocacy on.
So social justice continues to come up in the headlines surrounding the COVID vaccine rollout. It's just my understanding that in Massachusetts, some local health centers are really being targeted and supported by the state to ensure that the vaccine gets to them and that their supply is available in those cities and those communities. And I'm wondering if you, in a city like Lynn, which I'm sure has a very high COVID positivity rate, how have you guys experienced the vaccine, its rollout in terms of accessibility and all the rest?
So we've been very lucky in the sense that the state has essentially provided us with whatever vaccine that we've asked for. We've also been enormously lucky in the sense that the city decided to dedicate a huge amount of resources, a significant amount of resources towards vaccination. Massachusetts may be one of the rare states where they decided to prioritize health centers, particularly those who are in hotspots. Overall, we're seeing very good response in terms of African American community, Latino community, but obviously it's requiring us to do extra in terms of outreach to make sure that we are calling our patients, particularly those who might be ambivalent. They need that one-on-one conversation with somebody from their team before they're comfortable allowing themselves to be vaccinated.
Well, that is the end of our time. Kiame, this has been an absolute delight. Thank you so much for making the time to talk to me. Thank you so much for all of your thoughtful answers to all of these questions. This has been incredibly informative to me. I've learned a lot. I hope you all will have me back to do more of these. If anyone is watching in the audience right now and you would like to learn more about the Lynn Community Health Center, how to support it, what it does, please visit lchcnet.org/donate. Thank you for joining us. Thanks, Kiame, for having me. This was wonderful.
Thanks. This was my first prolonged interview, and it was a great experience. So thanks so much, Jason.
I think we nailed it. I'm going to be honest. I think we nailed it.